Well, I wanted to share with you guys today some of the thoughts that I have, and Ryan and I worked together on around how to navigate this budget situation that we're in. And I think for OFA, I see us at this perfect, and well, it's not perfect, but unique intersection of things aligning for us. So we have this budget situation that we have to deal with. We have a key staff person retiring, and we have me, new eyes on the on our staffing, thinking about how could we do things a little bit more efficiently. And in that same line, we just came off of our furlough, where I think my team learned a lot about how could we operate if we needed to. So I have some changes in our staffing that I'd like to discuss with you guys today and answer any questions about. This all has percolated out of what's best for seniors. I've had the privilege of working with OFA the whole time I've lived in Lewis County. So I've been on the referral side of things, working with the agency, referring clients and seeing how things unfold. And now I've had the opportunity to be on the inside for 9 months. And I think we can do a better job. I think we can make things smoother for clients. Right now, clients come to us, say a daughter calls and says, hey, my dad's recently widowed, my mom died, he needs help with meal preparation. Okay, our nutrition program will be right out to help. So we send our nutrition program examiner out. He goes out, does an assessment, and then he gets out there and he's meeting with dad and daughter, and we realize that he also needs help with housekeeping. That how's he gonna do the laundry and do the grocery shopping? He has a visual impairment. He needs help with housekeeping too. So then our nutrition examiner comes back and sends our ISEP case manager out. There's a delay, and we're ending up, as you can see, being inefficient, sending 2 staff people out to do basically the same assessment. So my goal is to just have our case managers all cross-trained, and instead of serving seniors by program, we're gonna serve seniors by location in the county. So we'll have a northern part of the county case manager, a southern part of the county case manager. We'll go out, meet with Phil, see what Phil needs, get him what he needs as quickly as possible. Versus,
and you can do that in one day, or is that
that'll be next. I'll do that next year. But right now, I just want to take our silos away and serve people. I want to have all our case managers be able to get seniors what they need versus being broken up by program. And that will make us more efficient because everybody will be, our 3 case managers will be cross-trained. And we certainly learned the need for that during furlough. When I had 2 people from our 2 biggest programs, nutrition and ISEP, out, my other main case manager wasn't cross-trained in what they do. And so that, as you can imagine, really required some of the more senior staff members to do some more heavy lifting. We also have this opportunity to better utilize New York Connect's state funds. So New York Connect's is state funding with no county match, and we have a staff member who's retiring, who's she's funded 87% by New York Connect's, so that's 87% of her salary that's state funded with no county match that we can redistribute across other salaries in the department. So this is what our organizational chart currently looks like. If you follow the right-hand side of the chart, Chris Baker's our coordinator for services of the aging. She doesn't really have direct reports right now. Technically, everybody's kind of reporting up to me. And we have 2 coordinators, our meals program coordinator and our long-term care coordinator, who have their own areas of specialty. And then underneath them, these 3 positions: aging services examiner, ISEP case manager, and a specialist, that last position. The aging services examiner is focusing on nutrition. The ISEP case managers doing our ISEP, our home care program, and that specialist position is near connects. So he kind of does a little bit of everything. Health insurance counseling, legal and transportation referrals, a lot of referrals, linking people to support that they need. And Tina Stanford, our long-term care coordinator, is retiring in April. So as you'll see in the next organizational chart, I'm proposing eliminating that position. That's that fully, 87% state-funded position. Redistributing some of her coordinator duties to myself, and there are two other coordinators, Chris Baker and Vicki Meyer, who does our meals program. And then taking that specialist position and creating two additional specialist positions. So I'll have the three people that work directly with seniors day in, day out and are doing those home visitors. They'll all have the same title, have the same job responsibilities, because they're basically conducting the same assessment right now anyway. They're just getting paid different amounts. It makes sense to me that they're doing the same work. We should have the same title and pay them the same. And the titles don't have to be program specific. As I explained, for efficiency's sake, it makes more sense and it's better service for the seniors if they all have the same job expectations, because they're all doing the same thing anyway.
So those three would be the case managers?
Yes.
That you referred to earlier?
Yes. Yep.
And
So
they'd
they'll all
be,
know all the different programs.
Yes. Essentially, our current ISEP case manager will have to come up to speed a little bit on nutrition, which won't be a big learning curve. She already is. And our nutrition examiner will need to learn a little bit about Medicaid eligibility and home care services, which he's definitely ready for in his career path. Any questions?
Is there a standardized training to accomplish this that you can make yourself available to?
There is, Dick. So the state offers a case management training. Oh, sorry, I forgot to shut my phone off. The state offers a case management certification that we can have the two new people complete.
Okay, that's your idea.
Yep. Which they should have anyway, because like I said, they're conducting the same assessments in the home. Ryan, did you have anything you wanted to add?
Probably I will add the financial piece in our finance and
Okay.
rules meeting.
And
I think you guys.
here's the financial implications right here. So again, I want to remind you that the motivation for this is I strongly feel like this will be better for the senior that we're out visiting.
that's the bottom line.
It is, but it's also going to be better for the bottom line, Phil. Which is nice when that aligns. So this chart's a little complicated, but it outlines the 5 positions that we're discussing, and they're listed across the top there. The current the current grades for those positions, and then you can see the 2021 grade. If those dashes mean that we're proposing eliminating those positions. Our account clerk, we really learned during furloughs that our principal account clerk can do everything that she does. And so we are recalibrating her position to be more secretarial. And that's just a small wage decrease. So
big picture,
Yeah.
we are eliminating 3 positions, abolishing 3 positions, and creating 2 positions. Okay, so ISIP case manager goes away forever. Long-term care coordinator goes away forever. Those 2 people, long-term care coordinator is Tina, she's retiring. So that position is gone and the person who's in it is gone. ISIP case manager, that position goes and that person will be reclassified as a specialist for aging services. Same thing with aging services examiner. That position is eliminated. The person gets reclassified as specialist services for aging. So in this case, one person is taking a downgrade and one person is getting an upgrade to make 3 level positions that are going to do the same exact titles.
Is this got union bargaining implications for us?
No, because we're eliminating the position, which we have every right to do, and creating a new position, which we have every right to do. So we have involved the union. We gave, obviously, the employees that are affected, sat down with them last week because I didn't want them watching it on Linking Lewis without knowing that we were going to talk about it. And we made sure the union was present and, was able to advocate for them and hear everything that we had to say. But the bottom line is the union controls what positions are in the contract. They don't control which positions we decide to employ. They decide, through our collective bargaining, we have to pay a specialist services for the aging $19.75 an hour because that's what the union negotiated. Union can't tell us how many specialist services for the aging we have to have. You see what I mean? Unless they're the city of Watertown and bargain that away.
So how did the employees receive it?
I'm
I'd
just
rather
going
get
to
in-
caution everybody that we don't really want to go into detail on particular personnel. We're certainly not using names.
Yeah.
If you're going to have this discussion on the record.
I'll talk to you after, or we can go into executive session.
I think in general, I would say my team is I've been very transparent for since the beginning of August about this being my vision for the department and the why. And the majority of our team completely supports this idea of having 3 people at the same level who can provide the same level of care to seniors.
Your team has an incredibly good commitment to the seniors.
I would agree.
They're dedicated to it.
So we were talking about this when we talked with Crystal's department, Caitlin and I last week. My message was, we should really look at this as a win-win-win. One, it's a win for seniors because they're going to get better care. You're not going to have to schedule 3 appointments to get services for the aging. You can meet with one person, get to know them, build that relationship, and get all the needs taken care of. Second of all, it's a win for the county budget because we're eliminating a large position, and which I'll get into in finance and rules, but it will be a budget reduction that will save us some money next year and in the long run. Then the third win is for department efficiency. Even in-house, the way we have our positions set up is very siloed, and it doesn't need to be that way. You shouldn't have to wait to serve somebody or wait to get paperwork done just because someone's on vacation for a week. We all can chip in towards the programs, and I think that'll be best for everybody. So, the downside is that we're asking, we're taking some position downgrades, but the upside is we're keeping everybody, and we've got a win-win-win scenario we think that accomplishes some good things. So that's where we're at.
Can we go back one slide? For a
Sure.
second? The OFA Advisory Council,
Yes.
what is that and what do they do?
So our advisory council is 12 people, 1 representative from each legislative district. They meet with me quarterly to talk about initiatives, future vision planning for the department. I think of them as a board of directors helping to advise us around vision, where we're headed, and they're all seniors from your districts.
Should we know that, who they are?
I can certainly provide a list for you.
No, I'm just wondering.
You guys appoint them.
Yeah.
Yeah, it just, maybe I'm in a fog, but it just didn't seem to be anything I could explain right off the top of my head.
Yeah.
Okay. And it must be going well because nobody's contacted me.
I think it's going great. I've met with them 3 times since I've been here, and yeah, it's a great group of folks.
Okay.
So Vicky won't be affected at all. Her position is.
The only impact on Vicky is she'll have a little bit more responsibility. None of our current, we're not proposing any of our current staff people losing their positions. Losing employment with the county.
just through attrition.
Right. Right. And our approach to the budget for 2021 was how can we preserve services? I don't want a waiting list for ISAP back. The last thing I want is a waiting list for meals. And so any way that we can be more efficient to preserve services and keep no waiting lists, that's my number one priority.
So Crystal, you feel this will definitely help the aging community?
I do. I think that silos, having a nutrition person, having a home care person, it just slows things down for seniors. Then there's two people to interact with, folks forget who they're supposed to call for what. This way they'll have a case manager that manages all of their services at OFA, who understands all of our services, who they know and who they see every 3 months.
Someone they're comfortable with.
Yeah, instead of, do I call that nutrition person? Do I got to call my home care person?
Mm-hmm.
Yeah.
Good, sounds good.
So no action required because we'll do these changes through the budget. But again, we don't want to put things in the budget without trying to make sure everybody's up to speed with what we're looking to do.
Any more questions for Crystal?
You're welcome. Thank you
very
guys.
much.
Yep.